I think it's number one, you have to look at your own practice and who are your typical patients and
Yes.
what do you see as the need that you like to serve them. So that could be nutrition and something. So say it was just nutrition, then get someone who's really focused on that.
Right.
If it's movement you want to incorporate it in, then get someone who's really specialized in that. If you want to offer sort of all lifestyles, then you probably need someone who has a breadth of experience in a bunch of different areas. They might not be, super awesome, the most effective nutritionists, but they're really damn good. But they're also good in movement. They're also good in sleep. They're also good in other things as well. So it really depends on what you see as your patient base and who could benefit from these.
Hi, this is Dr. Ross Carter with the Regenerative Warrior Show. Today, I want to welcome our special guest, Deepak Sain. Welcome to the show today.
Thank you for having me. I appreciate it.
Oh, I'm excited today. We're going to be talking about how and why medical providers should actually be working with a health coach in their practice. So basically, take a lot of the workload off of a provider so they can offer services but not have to do all the work themselves. Pretty much, is that accurate?
Yeah, that's one of the things for sure. Yeah.
Okay, great. So you actually said that there's four good reasons. So thank you for coming on the show, and let's get started. So how long you do health coaching yourself, correct?
I do. I consider myself a health performance coach.
Tell me about that.
Yeah, so I basically help my clients optimize aspects of their health and wellness and performance to be the best versions of themselves, so they can make positive changes, with themselves, their families, and their community. So, and with my private clients, I work on their mindset, motivation, nutrition, movement, stress mitigation, environmental factors, even for those who really want to push the envelope, biohacking and longevity as well.
Excellent. That's nice. And so, do you utilize a lot of different biohacking tests? Like, do you do genetic or epigenetic testing, nutritional testing, gut biome, sleep things? What is it that you typically do?
So it depends on what the client's needs are. If they're kind of at the starting point, we're going to hit the, I don't want to say easy things, but let's just get nutrition and movement, et cetera, dialed in where needed. Yes, I'll certainly get labs ordered, either independent labs or from their doctor, and we can do some. I like at least a basic genetic test. A lot of people have 23andMe. I mean, that's basic, but as a starting point,
Yes.
and certainly we can do some of these other things as well. So it really depends what the client needs and what their budget is as well.
Perfect. So you had said that there are really four primary reasons why a medical provider should be working with hand in hand, basically, with a health coach. So let's go through those reasons.
Sure. So, I mean, number one, very basic: serve your clients or patients, better. Give them all the support that they need for their health and for their health journey. So that's number one. Number two, round out the services that you offer in your practice. I'm sure all your listeners are, very knowledgeable, even experts in their specialty and probably in multiple areas. But maybe they can't offer every service that they've wanted to
Sure.
in the past. Number three, simply save yourself some time. Time is our most precious asset for sure.
Definitely.
While taking lifestyle, mindset, habit change, really digging deep with the patient is probably super interesting to all of your listeners. Is it the best use of their time, actually? And number four, the big one, most people are interested in, is actually boost your practice's income. By offering more services, could be movement, nutrition, mindset, motivation, other lifestyle factors, or package those all together, or B, create the spread on the difference of what you charge your clients or patients versus what you charge the coach. And that could be anywhere from 20 to 50%. And, especially with using virtual coaches now, which is pretty much acceptable now,
Right.
low overhead, that amount can really add up to the bottom line for your practice.
So if a provider wants to utilize services, So they don't typically have to outlay any initial cash flow, do they? Or cash?
No, I mean, it depends how, I guess a couple things, what the practice is now,
Mhm.
what they offer, what they want to incorporate in. But generally speaking, for, nutrition or movement or anything, I mean, some, they might want to build a gym and have that in there. But if we're kind of talking virtual here,
Yeah, probably
offload
not. Yeah.
that onto the coach, to do virtual things. And yeah, it's very little overhead potentially.
And so how would a doctor or a medical provider get started with this? What's the first steps?
Well, I mean, certainly something that I can help anyone with. Not only for myself, but I have just a network, a Rolodex of qualified, and I want to make sure we underline that qualified
Right.
health coaches that have proper training, and there's certainly so I can certainly help anyone if they want to get started. But look at some of the national accredited associations,
Okay.
and you can look at people there. And it's going to depend what your niche is, what you specialize in, and what fits with your practice. If you're diabetes management, find someone who kind of that's what their specialty is. And you're going to be more aligned. If it's XYZ, find someone who sort of fits the bill or has a broad range if you want to offer a broad range of services.
All right. And so once we narrow down the provider or what they're working with, and I guess their needs, what would they do then after they've okay? So they're with a patient, and let's say the patient needs to lose weight, and they need to go on a like a detox or a cleanse, or and then do a specific like a Mediterranean diet, for example. And they then why so they're like getting instructions, but of course the patient probably heard like a third of that. And then so how would the coach fit into that scenario?
Sure. Let me give an example that I use. I
Right.
work at a practice here in my local area. So when the MD provides lifestyle things, could be sleep, could be in your case your example diet, then they book an appointment with the coach or the nutritionist or however it might be.
Mhm.
And say this is what I think they should do, but the patient might be resistant, so it's a bit of give and take. So this is what we'd like to see, what the doctor would like to see. How can we move you there? And it might be a process. It might not be exactly what the doctor wants day one. You got to work the patient that way slowly, make those changes, and then have the regular follow up. And that's typically what the MD can't necessarily do. Can't see the patient every 2 weeks for follow up. How's it going? Let's do a food log, right? That's not a good use of your time. Put that on to the coach or consultant to do that and have that regular follow up at a obviously a lesser rate than what the doctor would charge, and then they can have some positive change tracked over time.
Imagine being able to change your genetics on demand so that you look, live, and feel your best. Now, years ago, the common belief was that your genes were your genes, and there was really not much you could do about it. But in the last few years, researchers have discovered that you can flip your genes on and off like a switch. So, can you imagine being able to switch off chronic disease or chronic pain and switch on health, vitality, and youthfulness? That's what I'm going to show you how to do with results that are guaranteed. Simply go to youngerguaranteed.com. That's youngerguaranteed.com to learn more. And typically, how frequent do you work with a client?
It's going to depend on what the patient's needs are for sure. How you want to build it into your practice. Is it like a lump sum type of executive type program where you just build it into the price? And myself personally, I like to see clients every 2 weeks,
Okay.
just so there's time for them to actually make the change, but there's also accountability at some frequency as well. So, but it's really independent of how, I guess, to a degree, the client's budget as well.
Gotcha. And so obviously this is not an insurance-based program, right?
It potentially could be.
Oh, really?
Yeah.
I didn't know that insurance would cover health
Well,
coaching.
okay. So let me take a step back. I
Okay.
said potentially could be. So the NBHWC board certified health coach. That's a program.
Yes.
It's not quite there yet, but they're hoping, from my last understanding, that by 22 that they're going to push that across the goal line. So it's getting pretty close to actually being an insurable service.
Oh, okay. Well, that's interesting to know. So,
Sorry, Dr. Ross, if I could just add one more thing. Depending on people's professional, their work plan includes, their work plan might include like a personal trainer, but no, maybe not a health coach. But if you have a health coach that has both of those certifications, maybe there's a way that could work out. So,
oh, that makes sense. All right. So, so if a doctor's working with a health coach, would they? Is it typically a per client? If in terms of billing, would they do it per client, or would this be a like a monthly charge, or how does the finance work with a provider?
yeah, it could look a lot of different ways. So let me just take one step back first. So, probably the preferred method is to have sort of a in-house coach slash consultant that you contract out. So low overhead, you just pay that, the coach's hourly rate.
Okay.
And then, you can build the client per basis or build into a package to sort of answer your question. Second, probably most common is to have an in-house employee where you actually hire the person, they're part of your practice. You got some more other things going there, tax considerations, all that type of stuff. Or third, probably the least effective in my experience, is you just hire out to some third-party service where it's like, hey, Doug, you need to lose weight. This is who we use. Off you go. You lose a bit of that control, that bit of connection between the practice and what the client is doing off. So again, the preferred method is to sort of contract to an independent coach. And again, depends how you want it. You can build into a package. You get 10 meetings, and it's just built in, or it's by individual basis, or whatever makes sense for your practice.
So if it's on, like, let's say it's a patient hourly situation, or do you normally do a session for half an hour or an hour, or which one is it?
Again, it sort of depends what the topic is. I mean, personally, my personal one-on-one clients, I do hour-long sessions, but it could be as short as a half hour as well.
Gotcha. And so give me some idea on what this would cost a practice in general per client for, like, let's say it was hourly. What is the kind of the standard or a normal rate range so that people can have an idea of how much it would cost?
Yeah, I mean, again, it sort of depends on, I guess, the geographic of your area, where your practice is, the services being offered. But let's just say, kind of ballparking.
That would be
roughly sort of like, the coach would be command somewhere from, this would be on hourly rates. So anywhere from like 80 to 100, maybe a little bit more. And then, typically the practice could add up, add an overhead, or on top of that, another 20-50% on that. So so it could be 100 to the coach, 150 to the client. The practice makes 50. Yeah.
Oh, that makes sense. Okay. So that would be a easy mark to start with, so that they have a little, they know where you're going from the beginning. Yeah, sure. So let's say, okay, so if you're charging, let's say 150, let's say for the patient, the doctor's charging 150 per session, they would say maybe schedule, like, say 2 sessions a month, like you had mentioned, would be probably for sure common. And how long a period of time is a normal routine or schedule?
Again, it's going to probably depend. I mean, you're going to know your patients the best. If they have 100 pounds to lose, that's not something that's going to be done effectively, safely in a couple months, right? Yeah. If they need to work on sleep, maybe there's some mindset stuff. I don't know the breadth of your audience, yes, Dr. Ross, but sometimes if it's going into surgery or something, this needs to get worked on up top, the brain, right? And why we even want the surgery, what have you. So there's a lot of nuances there. So it could be as short as maybe 10 sessions. So a couple months, could be something long term where you're just a part of the team and you're part of this long term care for your patient.
I mean, for my training in this, it would be the typical sessions I see are like a 3-month, a 6-month, and then a 12-month. Would that be a normal idea?
Yeah, for sure. I mean, again, and this is not exactly what we're talking about, sure, but myself personally, I only work with people at least a minimum of 6 months, because I want to make sure they get their goals and their change. It's usually actually a year, but I that sort of package model doesn't make sense, and probably 3 months would be the minimum.
Imagine being able to change your genetics on demand so that you look, live, and feel your best. Now, years ago, the common belief was that your genes were your genes, and there was really not much you could do about it. But in the last few years, researchers have discovered that you can flip your genes on and off like a switch. So can you imagine being able to switch off chronic disease or chronic pain and switch on health, vitality, and youthfulness? That's what I'm going to show you how to do with results that are guaranteed. Simply go to youngerguaranteed.com. That's youngerguaranteed.com to learn more. Right. Yeah. So basically what I was mentioning.
Yeah, exactly.
Yeah, that's normal. Okay. And so, all right. So the basics are pretty much covered. And most coaches can really handle, or do you want to pick your coach based on the specialties that they are experts at? Is that accurate?
I think it's number one, you have to look at your own practice and who are your typical patients and what do you see as the need that you like to serve them. So that could be nutrition and something. So say it was just nutrition, then get someone who's really focused on that. If it's movement you want to incorporate it in, then get someone who's really specialized in that. If you want to offer sort of all lifestyles, then you probably need someone who has a breadth of experience in a bunch of different areas. They might not be, super awesome, the most effective nutritionists, but they're really damn good. But they're also good in movement. They're also good in sleep. They're also good in other things as well. So it really depends on what you see as your patient base and who could benefit from these. And look for a qualified coach. And again, I underline that qualified.
Qualified is important.
Yeah. A lot of people call themselves health coaches, but they don't necessarily have the training. And if I could just offer, again, probably somebody that's NBHWC certified. And then I would also throw another top, the International Coaching Federation. So that's not health and wellness per se, but there's a lot of programs that are accredited with the ICF that do have a health and wellness focus. And I think the blend of those two go very well together. But I mean, you got to decide what's best for your practice.
And so for you specifically, where are your specialties? So if somebody was thinking, I want to work with you, what areas would you be best to, what kind of clients are best to work with you?
Sure. As I mentioned earlier, with my one-on-one clients, I do the whole gamut of everything: nutrition, mindset, movement, environmental factors, biohacking, sleep, stress management, all of that. Some of the clinics that I partner with, they don't ask me to do everything. They only ask me to do certain pieces of it. So I'm comfortable doing movement or movement and nutrition at another place. That sort of thing.
So let's say a provider wants to hire you, but they want it to seem like it's part of their team. You know how you were saying you don't want it just like to throw it off to somebody and then how. So when you're working with their client, how do you make it like this is part of our team, like part of the medical team, and not just some external service that we? How do you make sure that relationships looks like that or stays like that?
Yeah, so I'll just use sort of my current experiences. So you're on the website, you're part of the team, you're the health coach or whatever you want.
Oh yeah, you'd be
health
consultant. Okay, so part of
right.
On the website, put that on there, part of the staff or whatever. That makes sense.
Billing goes through the practice. Right. So I'll invoice the practice, but for the client, it's seamless. They're not doing a separate or anything. So it looks like you're totally, part of the team. The MD will refer. It's like, we're going to refer you to Deepak or Bob or Susie, for follow up. Book your appointment at the desk. That type of thing. So it just looks seamless. Like they don't even know you're not even a full-time employee or what have you. Right. Perfect.
All right. So if somebody wanted to work with you, like a provider wants to work with you, how would they get in touch with you? What's the best way?
Yeah, the best way, probably just email me. We could probably put it in the show notes, but it's info@Deepak Saini Health, DeepakSaini health.com, and reach out. And again, if I've some availability right now, but even if I don't, or maybe we're just not a good fit for what you're looking for, again, I have a big Rolodex of qualified coaches that I can refer to and get you started on incorporating this into your practice.
Wonderful. All right. I think I've got all the information. Thank you so much for your time today. I appreciate the interview.
Thank you for having me as a guest. I appreciate it.
Thank you.